My name is Tim Talbert. I'm a cardiac electrophysiologist here at NPMC. I went to medical school and residency at University of Tennessee in Memphis, and then on to cardiology fellowship and electrophysiology fellowship at Baylor University Medical Center in Dallas. I've been working in the EP field for about 27 years now. The most common single condition would be atrial fibrillation, which is an irregular heart rhythm starting in the top part of the heart. Several different things cause it, but it is a very common rhythm, the most common abnormal rhythm in cardiology, and it is a very difficult rhythm to treat. We've developed in electrophysiology many techniques over the past 20 years to treat that, and we've been doing what's called an ablation, which is a procedure where we map out the spot where the rhythms come from in the heart, in the left upper chamber of the heart, and we can ablate them, or otherwise you could call it cauterization, or just burning the spots where the rhythms come from, and as a result, in 80% of the cases, they're a pretty good outcome. I've been doing this for 27 years, and staff here is excellent. I'm very pleased with that. We have all the equipment that you could get anywhere is here at NPMC for what I do, and these things are moving along pretty well. So we're a full-service electrophysiology laboratory. Well, the major problem in electrophysiology is that really only about a third of the people who have heart rhythm problems in most cases are ever seen by an electrophysiologist. The earlier we get a hold of somebody who's got a problem like that, especially atrial fibrillation, the better. And if somebody is having trouble that they're not that's not responding to treatment, or somebody has other issues, it's probably best to see not just a cardiologist but an electrophysiologist as soon as possible, because those things need to be dealt with fairly early on. The results of treatment are so much better when you deal with somebody who's had this for 3 months instead of someone who's had it for 3 years. I suppose that stands for any medical problem, but for atrial fibrillation, the heart changes and gets enlarged with atrial fibrillation, and this rhythm is not just an abnormal rhythm, it also does damage to the heart and starts out microscopic scar deposits and gets bigger and bigger, and these things get worse and worse and harder to fix. So the earlier, better.